This is Dr. Frez at the Chiropractic and Injury Center. Today we're going to be talking about low back pain. See a lot of low back pain come through the office. The crux of the problem has to do with the way the spine is constructed. Right? The way we're looking at the woman in this chart, there are three curves. All right? There's a curve in her neck that looks like a reverse C. There's one in her low back that looks like a reverse C. And then there's one in the middle that goes in the other direction. And if you think about it, it kind of forms a spring. The head is heavy. It weighs the same as a bowling ball. The torso is heavy. So this curve, or these curves, are the shock absorbing system. So again, going over a speed bump in your car, right? The shock absorbers distribute the weight of the car. Well, these curves distribute the weight of the head and the torso, okay? We're kind of weirdly built if you think about it. Again, the head is heavy. It weighs the same as a bowling ball. And then if you think of the torso, it's broad at the shoulders and then it tapers at the waist. So it kind of looks like an inverted triangle. It's very top heavy. The only way we can get around that is by having these curves. So in the low back is where all the weight ultimately goes, okay? So these lower back segments is where the weight of the head and the weight of the torso, they bear the brunt of all of that weight. So when the curve is there, when the shock absorber is there, there isn't an issue. But what we see are changes in this curve. The thing that we're going to see most often is that curve begin to straighten, and as that happens, we lose that springiness or give. In the low back, sometimes we see too much of a curve, right? So we'll measure the curve, and there's too much. It's almost like the lower back is beginning to compress, right? As the weight's coming down, the spine is beginning to compress. Muscles go into spasm, and it can cause a heck of a lot of pain. So if you suffer from low back pain, you're welcome to come into the office. Let us do a consultation. Let us do an exam. Let us take some x-rays, some pictures, see exactly what's going on with that low back so that we can determine if it's a chiropractic case and see how much good chiropractic can do for you. This is Dr. Frez at the Chiropractic Injury Center. Thanks for watching.